Hi everyone! So the quality on this is terrible, but this was the best that I could get with the camera that I have. So I will take a picture of my poster board and post it in the discussion. So I did mine on an axillary-bifemoral bypass graft. There are different kinds of bypass grafts, and they get their name from the two arteries that they connect to. This kind of bypass graft connects the axillary artery to bilateral common femoral arteries. Bypass grafts are used to bypass an area of obstruction. This bypass graft was in a 75-year-old male. He was a new patient and we had no history on him. All we knew from his order was that he had this graft but nothing else. Upon talking to him, we found out he had quite a long history. He has elevated cholesterol, hypertension, peripheral vascular disease, coronary artery disease with a stent. He's had a heart attack and multiple TIAs. He's a former smoker of 20 years. We also found out that he had bypass grafts in the past. He had a femoral graft that failed and a right femoral popliteal graft that failed. When he came in by us, he was complaining of bilateral foot pain at rest and bilateral leg pain when walking. He mentioned that his left leg was worse than his right. So 3 of my pictures on the board are from his abdominal duplex. His aorta and bilateral iliac arteries were occluded. So I have one of the distal aorta, the left external iliac, and the right external iliac, and you can see that they're occluded. And then I have 3 pictures from his grafts, and one picture is of the distal anastomosis going into his left common femoral artery. One is of his mid-graft, and the other one is of his proximal anastomosis into the axillary artery. This was a very interesting case to see. I was able to post-scan this patient, and it actually wasn't too hard to see because it was very superficial. And we could actually see his bypass graft underneath his skin at some points, and you could feel it when you ran your finger over it. And we discovered this bypass graft to be patent.